This module outlines the medications to review when asked to see a patient with delirium. By the end of the module, you should know what is involved in a medication review for delirium and know what medications can cause delirium. Delirium is an acute change in mental status that is often triggered by acute illness, surgery, or adverse effects of medicines. There are also many other causes of delirium. Delirium is common in the hospital setting, and medications are a potentially reversible cause of delirium. Polypharmacy and particular medications can increase the risk of delirium, particularly in older adults. As a junior doctor, you will often be asked to review patients in hospital with delirium, and it is important to consider their reason for admission, timing of the change in mental status, and triggers such as infection. It is also important to review medications in all patients with delirium. To conduct a medication review, first we need to determine an accurate list of the patient's medications and match each medication to the indication. In a patient who is confused, this may require a call to the patient's carer or general practitioner. Check if there have been any new medications or changes in medication dosages, as drug interactions can also contribute to delirium. Determine their adherence and the completeness of the inpatient list, as withdrawal or omission of medications can also contribute to delirium. Consider whether each medication is still required or whether it could be causing an adverse effect. Consider stopping or weaning medications that are no longer required or could be causing an adverse effect. In terms of medications that can cause delirium, psychotropics are a group of medications that can commonly contribute to or cause delirium and include antipsychotics, antidepressants, hypnotic sedative drugs such as benzodiazepines, and lithium. Analgesics such as opioids and gabapentinoids can also cause delirium, but it is also important to ensure that pain is controlled, as pain can also contribute to delirium. Antiepileptics, Parkinson's medications, antihistamines, and anticholinergics can also contribute to or cause delirium. In the hospital setting, patients may also develop a postoperative delirium after having an anesthetic. Corticosteroids, particularly at higher doses, can cause delirium, and similarly, digoxin toxicity can present as delirium. Infection is a common cause of delirium, but less commonly, particular antibiotics such as quinolones can also cause delirium. So a lot of patients with delirium will be taking these medications. However, it does not mean that all patients should have these medications stopped. These medications should be reviewed to ensure that there is an appropriate indication and that the dose is appropriate. In cases where a medication is no longer required or could be causing an adverse effect, it may be appropriate to stop or wean the medication. If you are unsure whether to reduce or stop a medication or how to do this, as some medications need to be weaned to avoid withdrawal symptoms, check with your registrar or consider advice from geriatrics. For further information on how to conduct a medication review, these are resources on medication review from the UK and Australia.